Good morning, everyone. As a clinician, may I ask you, have you ever think of yourself lying on sick bed? I think most of you haven't think about that yet because as clinician, we tend to think ourselves like we treat people, not being treated by somebody else. That's really hard feeling when you actually lying on a sick bed. So, as do the patient. So why don't we think ourselves as patient when we treat them? How do they feel? What do they feel? I know there are some barriers like okay, a lot of people afraid of doing so because it's time consuming and sometimes you never predict what patient does. So in order to clarify that, the Australian Commissioner of Health Safety and Quality have established the AHPEQS, which is the Australian Hospital Patient Experience Question Set. It's pretty simple, just 12 questions comprised of a number of dimensions from patient feeling about their treatment, the staff communication, and their confidence in health staff, which is pretty useful for health practitioner to have a different view from patient view actually. So therefore they can improve their practice and therefore improve patient outcome because patient confident in practitioner, not just the technical skill or professional skill but also communication skill, can ensure their commitment to treatment, therefore enhance the patient outcome and their responsiveness to the treatment, which has been proven in literature. However, yes, there are another barriers, a lot of other barriers. So I think as I list in my essay, we can start thinking step by step. Uh, we just I know that some people, some of you will think that okay, their survey outcome usually accordingly to their happiness, not just to the treatment they receive. It's true at some degree, but not totally true or the whole truth, as you can see, because when you stick to the guidelines and you stick to the treatment and you explain that to the patient, like tell so do for the kids, and I think it's pretty true for the adult as well. You tell them what you're gonna do, you show them what you're gonna do, and you do it. So they will be more confident in your clinical skill and social skill, and therefore they are more commitment to the treatment. So it's really hard because a lot of time doctors tend to we don't have enough time to sit there and explain everything to the patient, or sometimes doctors tend to use the clinical terms or technical terms which are not understandable for patients who doesn't have the proper medical training. Therefore, using plain language, tell to them. We can start slowly, like by sitting down with them and at first tell them in plain language what we're gonna do. We can just start it for the first month, and then we by the survey we can see how patient outcome or patient satisfaction improve, and we can compare that to their health outcomes improvement or not. Then we can proceed to the next stage, like we tell them, we show them what we're gonna do, or we just animate like imagination uh, outside their body. For example, if you're gonna do some intervention, like I'm gonna take your blood or something, just imagine uh, needle gonna be like this, or I think most of the patient, they will be scared the first time, but then they will feel confident in you and your skills. And then while you do it, you can reassure the patient during the procedure. So this tell so do thing, I think, is really works because you create the patient, they feel safe with you. So we can start step by step. By first month, and then we hand out the survey, and then for the second month or after the course of treatment, we give them another survey to reassess their satisfaction, and then we compare with their health outcome, and then we can compare it with the Australian national statistic of health outcome, which is available on ABS website census. So this cycle of action, I prefer it to plan, do, study, act, PDSA cycles. We plan to do it, and we do it, and then we study from the failure or success, or whatever you want to call it, and then we plan our chance, we solidify our chance. That's my plan. Thank you.